Thank you everybody for coming out again to one of the lectures. They've been very well attended, and it's great to know that people are wanting to be educated a little bit more. If there are any topics that people would like the Education Committee to investigate for upcoming lectures, please let us know, because otherwise we're not sure that we're meeting your needs. One of the other things that if people have puppy families who you think might be a little bit interested in joining Dogs Victoria, can I put in a plea that you might just sign one of your family members up to Dogs Victoria so that they get a chance to see the activities that are offered and the sports that their puppies might be involved in. Just about the next seminar after Stuart's, Ray Ferguson's going to come and give the seminar in October, which will be on managing arthritis and the older dog, but he'll also be speaking about managing puppies and making sure that they're getting the dietary needs in order to make sure that they sort of have minimal amounts of joint issues as they're growing. So really a worthwhile lecture to come and hear. The notes for the lecture tonight, you've picked those up, but also this live stream will be available on the Dogs Victoria website. If you open up the Dogs Victoria website in the top right-hand corner, you will see the link to the YouTube channel so that you can go in and access tonight's talk. I'll also come round with a microphone after the talk, and you can ask questions so that the people on the live stream can actually pick up the questions as well. So a little bit about Stuart. He graduated from the University of Melbourne in veterinary science with a degree in honours, and then after some time working in the country, he then proceeded to study further and managed to get a diploma in theriogenology, which is I thought I had that, theriogenology, which is the study of reproduction. With Stuart's membership of the American Association as well as the European Society specialising in reproduction, and being a committee member of the Australian and New Zealand Society, he's certainly here to give us expert knowledge tonight. He also has an advisory role at the University of Melbourne and has extensive experience in lecturing widely and producing webinars. So we're privileged to be his audience tonight. So thank you, Stuart.
I was just wondering, well educated, but then I looked at my first slide that I've got that. So tonight we're going to give sort of a brief summary on the normal cycle of a bitch and when you should, and how we determine when you should be mating your bitch for the best chance of pregnancy. So I guess I always start off with this slide, and it's my polite way of saying that bitches are literally bitches, and so they're one of the most difficult species that we deal with on a regular basis. So when we look from a phylogenetic history, dogs sit amongst bears, cats, rabbits as well, which are all induced ovulators. So that means that they'll mate in response. They'll ovulate in response to an actual mating. But they do their own thing, and they spontaneously ovulate, or they ovulate of their own accord at what's called a primary oocyte. So it's not actually an egg that's ready yet to be fertilised. That egg then takes another 2 to 3 days to mature to actually be able to be fertilised. And I think this is one of the things that a lot of people struggle to understand, because every other species that we deal with ovulates an egg that's ready to go. Due dates are exactly from when ovulation happens, and mating is when ovulation occurs as well, which is not the case in the dog. They cycle once or twice a year on average. Why they do that, we don't know. Other species cycle every sort of 3 to 4 weeks on a regular basis. They have what's called an obligatory diestrus period. So diestrus is the fancy name essentially for the pregnancy phase of the cycle. They have a 9 to 12 week period of high progesterone following ovulation, whether they're pregnant or not. Every other species, the fetus produces some sort of signal to the mother to say, hey, we're here, we're pregnant, don't cycle again. Dogs don't do that. They also have behavioural changes to coincide with their ability to mate due to declining estrogen levels, whereas every other species we deal with is actually due to rising estrogen levels. And the other thing is, just to top it off, to make it a bit harder, and I had to remove a slide so I didn't embarrass anybody here, but some breeders can be quite challenging to deal with. I think it sort of makes it all a bit harder. So, and understandably, like if we look at the history of breeding or the knowledge, I suppose, of the cycle of the bitch, we didn't know a lot until the mid-70s. So until the mid-70s, they were treated like mini cows and mini horses, and no one could sort of understand why they couldn't get them pregnant, to the point even, as you all know, when dogs mate, they tie and are bum to bum. So they'd be trying to stop that from occurring because that's not what any other species does, and they're actually reducing pregnancy rates rather than helping things along. So if you look at timing of when we breed, the timing of insemination or poor timing of insemination is the most common cause for a failed pregnancy in dogs. So it's really important to understand what the normal cycle is, and so we can predict when the best time to breed is for your best chances of pregnancy. Coupled with that fact, if they miss, you're 6 months down the track, and there's nothing you can do about that without reducing their fertility. So when we're timing bitches during their cycle, the three main techniques that we're using is vaginal cytology, progesterone assays, vaginoscopy, which is looking at the lining of the vagina and changes that occur. So I'll run through all of this later. But just to start with, I think it's important to understand what is a normal cycle of a bitch to help us interpret these tests. So the cycle of the bitch is split up into four phases. So we've got proestrus, which is the period before the fertile period. Estrus is our fertile period. Diestrus, as I said earlier, is the pregnancy phase. And then we've got anestrus, which is this period from the pregnancy phase to the start of the next cycle, where there's a lot of hormonal quiescence. So obviously, I don't expect you to, I'm not going to test you on this, memorise it, but this just explains the changes in hormones. So this is progesterone here. Progesterone, as you know, rises through the fertile period, continues to rise and peak at about 3 weeks of pregnancy, and then slowly drop off towards the end of the pregnancy phase. There's other hormones here. The important follicle stimulating hormone stimulates development of the eggs, and luteinizing hormone, which is another important one, which actually is what stimulates ovulation in all species. So how does it work? Basically, everything's under control of a hormone called GnRH in the brain. So gonadotrophin releasing hormone, that's what controls the release of luteinizing hormone and follicle stimulating hormone. So follicle stimulating hormone will stimulate follicles to be produced and enlarge. They start to secrete estrogen, and that production of estrogen has a feedback back on the brain to stimulate a surge release of GnRH. We get a surge release of luteinizing hormone, and then you eventually get ovulation of that follicle. So basically, like most hormone processes, it's all a negative feedback loop. So when a bitch is out of season, they've got low progesterone, which is what actually allows this GnRH to rise and what causes it to start the whole process of follicular development and their cycle. And so this whole process is occurring during that period of quiescence, getting ready for the next cycle. So proestrus, so this is the start of the cycle. So it's where we get the onset of swelling and bleeding. It's caused by increased estrogen levels from that follicle that's developing, and eventually estrogen gets to a point, it goes over a threshold essentially, causes a surge release of gonadotrophin releasing hormone, the LH surge, and then ovulation. So during proestrus at the start of the cycle, progesterones are low until that level of the LH surge. On average, in Australia, the LH surge is occurring at around sort of 6 nanomoles per litre. And at that level, under 6, we often get fluctuations in progesterone. I know people often worry, you know, you do a progesterone today and it was 2.7, and then we do another one in 4 days and that's 2.2, you know. It's really, you're testing a very small amount of a hormone in a large pool of blood. So we don't tend to worry about little fluctuations at that level. But once you've had that LH surge and ovulation process has started, progesterone should increase by a pretty consistent ratio. So at this stage is when you're getting your bright red vaginal discharge. The bitches are not going to be, in general, receptive to mating, and the average length of this is 9 days, but you can see here it ranges from 0 to 27. So the average cycle of a bitch is sort of probably 16 to 21 days, but it can be as short as 4 days, it can be as long as 43 days. So obviously I probably have a skewish version of what is normal, because I said the ones at either end of the bell-shaped curve, they're either very short or very long. But the majority are somewhere around 16 to 21 days. So estrus is the fertile period. That's where estrogen levels are starting to decline. It's after that luteinizing hormone surge has occurred, and we're starting to get a rise in progesterone. Through the fertile period, the vaginal discharge starts to change in colour. The textbooks all talk about a straw colour, but I'm not sure what they're comparing that to. It tends to go more a dark reddy brown discharge post or around the time of ovulation. But you've got to remember, a lot of these, what we call phenotypic changes, are not really reliable as to the ideal time to mate the bitch. She should hopefully be flagging, tail to the side when you stimulate the perineal area. But obviously, bitches and dogs are often very poor at determining the correct time for the mating. Like everyone says their stud dog's the best stud dog and you'll always know that right time to mate the bitch. I've had these great stud dogs mate bitches with anal gland infections that aren't even in season. I've had them mate bitches that have got pyometra. So there's a lot of things that can throw them off that we don't really think about. So yes, it can make a difference, and some male dogs are a bit painful that you cannot collect semen out of them unless the bitch is essentially ready to be bred. But as a rule, I wouldn't be relying on your dog to pick the right time. So again, average length of this is about 9 days, but you can see here it can be very short, it can be 4 days, but it can be as long as sort of 3 and a bit weeks. So estrus is that fertile time. Ovulation occurs 2 to 3 days later. The oocytes or the eggs are ready to be fertilised, and at that stage the sperm should be in, and so they move into a period called diestrus, which is the pregnancy phase. At this stage, progesterone is, quite high, somewhere over sort of 100, 150, results in closure of the cervix, which is important to help prevent, we believe, essentially unwanted products and getting into the uterus and causing problems. As I said, all bitches have an obligatory so it means compulsory 2-month diestrus period. A non-pregnant bitch, this will actually be longer than a pregnant bitch. So a pregnant bitch, it's obviously the 9 weeks, but the corpus luteum, which secretes progesterone, which would normally maintain pregnancy, that can hang around for up to 150 days in a non-pregnant bitch, because there's nothing to actually cause it to drop and fail. If the bitch is pregnant, the puppies release cortisol, that causes the corpus luteum to disappear, progesterone drops, they go into labour, and we move on. So it's just an important sort of aspect to remember that. There's a sharp drop in progesterone at the end where it drops below 6 nanomoles per litre, and that drop in progesterone stimulates a rise in another hormone called prolactin, and prolactin is very important for milk production and also for mothering as well. So, and then we reach the end of that diestrus period and we move into anestrus. And at this stage, there's not a lot of hormonal activity occurring, and it's a time for that uterus to regenerate. So bitches don't lose the lining of their uterus after each cycle, and because they've got this long progesterone phase, the glands of the uterus, which would normally secrete milk to help nourish the embryos, start to enlarge and they can become cystic with repetitive cycles. And so this is why pyometras at a higher risk in bitches that are never bred, because those bitches never have any ability to lose the lining of the uterus, and that constant hormonal change is just causing this endometrium or the lining to enlarge and become cystic, and eventually result in a large or major uterine infection. So during anestrus, we've got low progesterone. Those hormones I was talking about earlier, LH and FSH, are quite low and not really doing much until the end. But it's at this time that you get that regeneration occurring. And so this is where this has to occur for around 4 months. So we want a minimum of 5.5 months in between seasons in a bitch. If you have longer than 5.5 months, that's great. I actually think the longer the better. But when we have less than 5.5 months in between seasons, those bitches have a lower fertility, because in general it's due to a reduction in this anestrus period, so the uterus is having less time to actually recover before you've got another hormonal cycle starting to occur again. Towards the end of anestrus, those prolactin levels start to decline. You get a rise in LH and FSH, and then follicle development, and we're back to square one in proestrus again. So if you look at timing of insemination, vaginal smears, which I'll talk about how we take them and all the rest of it. Why do we do them? And, you know, just like Doreen here racing through her equine medicine, where the only treatment for everything is to shoot them. There's no horse vets here, so I'm safe. It's not for just one reason that we're doing this vaginal smear. There's a lot of emphasis placed on culture, which I'll go through shortly, but it's the most useful tool that we do. It's simple, it's easy, we can do it in-house, that helps stage what aspect of the cycle the bitch is at. I think it's a very underutilised test, and a lot of people, or a lot of vets, tend to take the smear, or take the cotton bud sample from the vagina, send it off to the lab and see what bacteria are present, which is not what we should be doing. So we use a moistened cotton swab just with some water, and we want to get deep into the vagina, roll it around inside the vagina, and then we roll the cells out onto a microscope slide. So you can see here, so you got the vulva on the outside here. So the bitch has a clitoris in the little clitoral fossa here, and the vestibule. So normally during a natural mating, the penis is right in here, and the bulb of the penis is locking up at the top of what is the back part of the vagina. So this is a vagina that comes through here, right through to the actual cervix. So when we're looking at cells, we want to look at the cells that are up here in the vagina, which you can see here from this demonstration, because otherwise, if you sample this out, just this out a bit, any time of the year, basically, it will look like the bitch is in season, because these cells on the outside are a bit like our skin cells, which is what we see when they're in season. So to culture or not to culture, I think really the wrong significance is placed on this. I spoke at the Society for Theriogenology meeting in the US recently, and there was quite a lot of talks on this vaginal and uterine microbiomes, which I've seen some interesting videos come through breeder channels that people have sent me, talking about all of this, but there is actually some merit in it. They're actually finding, so the uterus we used to believe was a sterile, protected environment. So except for when the bitch was in season, we thought it was completely sterile. But they've actually shown during pregnancy there are bacteria that are present inside the uterus, and it's all quite normal. It's essentially creating a normal flora, and these are multiple organs, not just the uterus and the vagina. So this is why I don't think a culture is really significant unless you had a sick bitch with a smelly discharge. Then possibly it's a significant thing to do. But what happens is if we just do a culture on a normal healthy bitch who's just in estrus, we're going to culture some bacteria. If you stick your hand on an agar plate and send it off to the lab, you are going to culture bacteria. If you didn't, you'd actually worry why not. So you've obviously stuffed the test up, because there's bacteria all over every orifice in your body. Those bacteria have important properties for essentially protection and defence of our bodies. So if we go doing a culture, we find, whatever it is I think the classic one that comes back from the lab is Streptococcus group G, which the pathologists will write, because pathologists are like lawyers. They write standard things to protect themselves, and they'll say Streptococcus group G is a common cause of neonatal death. It's sensitive to this and this, and the animal gets put on a course of Clevulox, but it didn't need it. And all you're really going to do is start to select for more pathogenic bacteria that are actually going to be more likely to actually induce changes in the uterus and changes in the animal and reduce your fertility. But it's a common one I get a lot, that everyone wants antibiotics for their dogs. They don't want them to catch an infection. We're lucky in Australia, we're still quite protected from sexually transmitted issues. Europe and America have huge issues with Brucella canis, which has devastating effects on the fertility of animals once they get it over there, but we don't have that here. We're still lucky. All animals coming into the country are tested, semen's tested before it comes in. So it possibly will get in eventually, but at this stage we're lucky. But yeah, we've just got to, like I say, culture is a waste of time and money, and I still get people that want swab certificates because the stud dog wants to know that the bitch doesn't have an infection before she goes to him, and it's a waste of money. So when we look at these vaginal smears, we're looking at changes in cell structure. So the normal cells of the vagina start off as small round cells with a prominent nucleus. And basically what happens is, which I'll explain later, is the cells are changing in response to lack of oxygen, and so as they go through the cycle, they get more angular and more like cornflakes. So at the start they're more like little fried eggs, but they have what we call a large nuclear to cytoplasmic ratio. So early in the season, these dots out here are all red blood cells because there's a lot of blood at that point. We get a few white blood cells. It's normal. They're normal parts of the protective mechanism of the vagina. And you obviously see bacteria. That's, like I say, it's normal. So as they move into estrus, the cells change. And so you can see these cells, they're responding to a lack of oxygen due to the tissue thickening from the estrogen, moving further away from its blood flow. And so what happens, the nuclei start to die off, the cells sort of angulate and losing all their ability to regulate anything. So these are sort of a classic slide that we'll get of a bitch when she's in estrus. So at the end of the fertile period, and it's interesting because this can actually look sometimes quite the same whether they're early in their cycle or whether they're late in their cycle, and which is where progesterone comes in some cases to determine which is the case. But diestrus, as I said earlier, is the end of the fertile period. Estrogen's very low, everything's shrivelling down and shrinking back to normal. The bleeding stopped, so you start to get these normal, active, healthy cells starting to be reformed. So you're getting these fried egg cells starting to repopulate your slide. These are all white blood cells. That this bitch doesn't have an infection. That's quite normal at the end of the cycle because it's helping to clean out all the rubbishy tissue that's sort of accumulated, helping to remove the sperm as well if the bitch has been mated. And then when we get to anestrus, you have none of this angulation or keratinization to the cells. So they're all the parabasal cells. I know it doesn't show up very well. They also fall apart really easily, these cells, because they're a bit more fragile, but round cells with a large nucleus to cytoplasmic ratio. So why do we see what we see? So it's all controlled by estrogen. So as I said earlier, in the normal cycle, estrogen causes the bleeding that we see. So estrogen causes what's called hyperplasia, so an increase in number of cells in the vagina, and hypertrophy, which is an increase in size or thickness. And so what happens is you've got blood flow at the bottom, and you've got these cells that get swollen, like the tissue gets pulled away further from the blood supply. So you get reduced blood flow to those surface cells, and that's what we're sampling. So they start to die, they swell and, just a bit quick, they swell and become pycnotic, which is an inactive nucleus that disappears, and these are what we're actually sampling. So we're basically indirectly measuring what estrogen is doing inside the bitch. So you can see here just in the diagrammatic form, so they start off with these parabasal cells. they start to enlarge in response to the lack of oxygen, and then as they start to die off, they get this angulated appearance, the nucleus disappears, and then we end up with this anuclear cell, which is classic of a bitch in oestrus. Back in, again, as I said, it's a fairly new field compared to other reproduction in other species, and back in the early days, this is all they used to actually, because progesterone assay wasn't available, all they used to time the bitches, even to the point of frozen semen. So a lot of the original frozen semen papers from the early 70s, they basically did daily vaginal smears until they saw that first day of diestrus of the bitch going out of season, and then they threw the sperm in on that day. Interesting, they still got sort of 75 to 80% pregnancy rate, but they had no other choice at that time. So, a lot of the old stuff will talk about certain ratios of anuclear cells to ones still having nuclei to help work out where they are in their cycle, but it's not accurate. But it just helps us to stage where the position is in the heat cycle. So when we see a bitch the first time for breeding management, I'll always do a vaginal smear on that first visit, and it just helps us to stage exactly where she is and what's going on. We sometimes do multiple smears through their cycle if their progesterone's not doing what we expect them to do. They're useful for helping to define what's called a split heat. Split heat is where a bitch comes into season, she fails to ovulate and she goes back out of season. So often they're in season for longer than you'd normally expect as well, but as they go out, we'll start to see that diestrus type smear occurring without a high progesterone telling us we're having a split heat and we're wasting our time mating on that season. So as I say, it's indirectly indicating what's happening with estrogen. So progesterone, which I'm sure you're all aware of, is a lot of what we use for timing, especially with fresh and chilled semen. Australia and Canada are the only two countries in the world that use these units. So if you talk to your friends overseas, they'll use nanograms per mil. So any numbers they talk in Europe and America, you need to multiply it by 3 to make sense to what we're getting reported here. So I used to convert everything to nanograms so that it was technically consistent, I suppose, throughout the world, but it just gets confusing because the laboratories here all report in nanomoles per litre. So it's important to remember that, because if you hear if you tell someone in America, your bitch was 10 today, we're going to retest her in 2 days, they would have a heart attack because you're not breeding, because that's the same as 30 in our units. So, yeah, it's Australia and Canada, everywhere else is this nanogram. So, but obviously we need to be consistent with how we collect our samples. There's different ways of measuring progesterone. The most common test nowadays is what's called chemoluminescence, which we'll go through in a minute. The gold standard is radioimmunoassay, which is a radioactive isotope that's bound to a progesterone antibody, and they look for the change in radiation level, but that's not available anymore. There's more and more in-house type test kits becoming available. These ELISA test kits that you can get, which are just give you a rough idea where the progesterone is, but yeah, I wouldn't be 100% reliable on anything like that. So if we look at this, you've got to remember this test is not what we call a direct test, so it's indirectly telling us what the eggs are doing. And it's one of the things that makes it not that accurate. So, so basically what happens is you have antibodies bound to a plate. So this is progesterone that gets put into the sample. The progesterone binds to these antibodies. You put another antibody in, which has some sort of chemical reactive thing stuck to it. I'm no chemist to explain this in detail. And then you make it have a reaction and it emits light. And so that's why it's called chemoluminescence, because it creates light. And the amount of light that it produces is proportional to how many bound progesterone particles we have in the sample. And then the machine spits out a number and says there's this number that's in it. And so we get this reaction and the machine tests that. So progesterone assays are great and it's important for what we do, but we've got to remember it's an indirect test. So there's a lot of other things that can go wrong with the test. So you get a huge laboratory variation. Each laboratory uses a different machine. It's not to say one's right and one's wrong, but consistency is something important. So you couldn't go to 3 different places and get your progesterones done and expect them to be compared to each other. So it's important to be consistent with what you're doing. Some machines are better than others. The laboratory I use, one of the reasons I like it is it's fully computerised. So the blood sample goes on a conveyor belt with a barcode on it, it disappears into the machine. The computer in it controls how much of the serum is sucked up to be put in the sample, testing well. A lot of the machines that are done in-house, and a lot of the laboratories too, it's still reliant on a person pipetting a sample out and putting it into a test well. And if you're a bit rough with those little pipettes, you're only looking at 200 microlitres, so 0.2 of a mil that you're usually taking out. If you're a bit rough with that pipette, you could end up with too much going into it. That's going to affect the result that comes out. You get air bubbles in it, that's going to affect the result that comes out the other end. So it's important to look for, I suppose, quality. These bigger laboratories, like the one we use, they shut all their machines down every morning for 3 hours to do quality control and double check that everything's running correctly. On top of that, you'll get different suppliers of those reagents that are causing the reaction. So if they change suppliers, they would have to recalibrate their machines to their previous substrates that they're using. And also you get the different machine manufacturers. So it's sort of, as I say, it's important to be consistent and understand why we worry about it. Because a lot of people say it's just a blood test, but it's not. And we're measuring hormones, they're bloody temperamental. So, so when we're collecting the samples, it's important, we ideally should do it at the same time of day. Fasting sample. If the animal's eaten before blood collection, that will actually increase the liver metabolism of progesterone and it'll artificially lower the result that's in the blood. There's different tubes. These gel tubes, so the pathology labs love these gel tubes. They have a gel in it, obviously, from the name, and you put your blood in, and when they spin it with a centrifuge, the gel goes into the middle between the serum and the red blood cells. And so that means that it's a lot easier for the autoanalyzers to handle because they're not going to accidentally hit your red blood cells. But these gels will affect the level of progesterone that's in the sample. So we use the plain tubes just to annoy the laboratory, no additive whatsoever. They have to manually spin them down and take the serum off, so it's a bit of bad luck for them. You need to spin the sample if it's not going to be analysed within the first 4 hours. So there's really conflicting data out there, I suppose, but certainly the most consistent is that leaving the sample for too long with the red cells mixed with the progesterone, because progesterone will be in the actual serum, the progesterone will bind to the red blood cells and artificially lower your progesterone result that you get. So not in every sample, I get some that they're right, but some of them I'm expecting a 30 today and it was 5. You know, and it can really throw out what you're planning on doing with the analysis. So if they're not going to be tested within 4 hours, then they should be centrifuged. You remove the serum and you put that serum in another plain tube with no additive, and at that point it's stable for quite some time. You can freeze it and it's stable for a long time as well. So, but once it's away from those red blood cells, it's pretty stable. It's also important not to chill the sample. If the blood's collected and it's thrown straight in the fridge, that will actually lower the progesterone level in the sample as well. So we have our couriers trained to keep them separate to their normal bloods because they always, straight in the car, everything goes into a chill box to protect it to go back to the lab. So if you look at results of progesterone, the LH surge, which is what stimulates ovulation, occurs at an average of about 6 nanomoles per litre or 2 nanograms per mil in the overseas system. Ovulation is going to be somewhere around 15 to 25, but ovulation is not confirmed until you get a progesterone over 30. And this is something that often people fail to do. I understand it gets expensive. Normally if I got a progesterone around this sort of level, I'd be telling people to start mating tomorrow. But I'd also say do another progesterone in 1 to 2 days to make sure it goes over 30. It really helps us to confirm that we've, one, mated at the correct time and helps us to interpret an accurate due date for the bitch as well. You get some bitches, and I had one recently, she tested 15, so I retested her the next day expecting her to be 30, and she was 16, and so I left it 2 days and she was 16, and it took another 6 days before she actually rose over 15, and then it was 63. So it can really throw you out when they're due. With fresh semen, it's not the end of the world. Fresh semen will live inside the bitch for up to 10 days, good fresh sperm. But it makes a difference when you've got people that are breeding, but they're working full time, they're trying to work out when their bitches are due so they can organise when they have their holidays and stuff to look after their puppies. So, and also when we need to really be worried about jumping in to remove puppies. So as I said earlier, the eggs that come out, they're arrested in this second stage division. They take 2 to 3 days before that division is complete. But interestingly, a guy in Japan has shown that the eggs can actually last for up to 9 days after ovulation. So we used to think after 2 to 3 days the eggs were dead and you're wasting your time, but we know that we can actually breed them later. But then it comes back to staging their cycle, because if you do put sperm into a bitch too far into diestrus, you can actually cause a pyometra by irritating the uterus. But they're all different, and that's where the next stuff I'll talk about with timing helps us to work out where they are, is important. Cervical closure, so some quite good published studies showing that once we get to an average progesterone of over 75, the cervix will close over. We can still overcome that with a transcervical insemination. I think in a lot of cases you could probably overcome that with a natural mating as well. But the cervix is closing on the theory being that the sperm's already in there and the fertilisation should be occurring and everything should be starting to develop. So certainly once you get a progesterone over about 65 to 70, a vaginal insemination is pretty well a waste of time. So if you look at a textbook dog, which I don't feel I see, every 24 hours these are the changes in progesterone that you'll get. But once it gets over sort of 30 nanomoles per litre, you get these huge error margins in it. So a 40% error margin in the test result is quite acceptable from a laboratory point of view. So a bitch that you might be expecting to be 60 could be anywhere from sort of 40 to 90 sort of thing. And so that's where it's important. We're looking for changes in numbers rather than a one-off progesterone and a one-off number. So when would you mate? I would aim to mate twice, 1 to 2 days apart, stayed in the day after they ovulate. So once we get a progesterone around 15, I'd normally be saying to start mating tomorrow, mate for a couple of days. Honestly, 1 20-minute tie is all you need, but we usually do 2 to cover ourselves. After that, it's just trying to allow the male to have a bit of fun, I think, which they say that dogs don't do it for fun. So. And so then the third technique we use for working out when to mate the bitches is vaginoscopy. So this is where we're looking at the lining of the vagina, and it's again, this is another indirect test for telling us what estrogen is doing. This is important for frozen semen. I sometimes use it for fresh and chilled to help confirm where I think the bitch is, but especially frozen semen, it's really important. It basically confirms what the progesterone and the vaginal smears are telling us. And we're looking at, if you remember back to that picture earlier with the cotton bud, we're looking at that outer part of the vagina, and we're looking for changes. So, and we need to do it slowly. Like technically, I think I could do the whole thing off just this now and time a bitch if we did it on a regular basis, but I don't tend to do my vaginoscopy until it's getting close to the point the bitches are going to be bred, because they don't mind you popping the scope in at that point. Because this endoscope's probably, it's about 25 centimetres long, and I think it's 11 or 13 millimetres diameter, so smaller than the dog's penis in most cases. So vaginoscopy, again, we're looking at changes with estrogen levels. So same as before, the estrogen causes the vagina to become edematous or swollen. After ovulation, the estrogen starts to drop and the vagina starts to shrink. And so that we're looking for this change called crenulation. So we get these, I've got a video of it in a sec. We get these primary folds and secondary folds developing, and the crenulation really looks like a cobblestone appearance to the lining of the vagina. It's actually quite interesting when you look at it, how much this organ changes through a bitch's cycle. It's quite amazing. It's confirming when ovulation occurs, and also it indicates there's a fertile period of about 3 days. It's telling us when the eggs are actually within that fertile period. So, you know, I suppose the trick with frozen semen we're looking for is we want low estrogen and high progesterone. I don't really care how high my progesterone is, and I don't really care how low the estrogen is, but I need to have those two things because estrogen's toxic to sperm. So what does it look like? So this is a bitch that's in proestrus. You've got these, you can see the red bloody discharge. It's quite swollen looking tissue there. And then this is a video I did of a bitch in estrus. You've got to bear with it. So we blow it up with air so we can see what's going on. And so you can see this girl was almost ready to be bred at this point. We've got these deep primary folds running away from us and little creases coming across from side to side. So she's what I call starting to crenulate. When the vets are doing this technique, you've got to be careful because you can, and I'm pretty sure I've got it in the video, you can actually put in too much air and it flattens everything right out and it really throws what you're doing. It doesn't show as nicely as that little scope I was using. This is a scope I use for the transcervical inseminations. But yeah, that's what we're looking for, as you could compare to that photo before. You've got that cobblestone appearance to the lining of the vagina. I think I do. Yeah, so you can see now it's getting a lot flatter. That's me moving around trying to clean it. So see how you're flattening it right out and you're getting rid of that cobblestone appearance. So it's a technique, I suppose, you learn by practice and a visual assessment. It's actually hard to teach someone. You just got to do lots of them and get comfortable with what you're seeing. And some bitches are easier than others with it. That's about it. All right. And so then when they're out of season, this is what it looks like. It's just this flat tube. There's no folds whatsoever within it. So like I say, it's quite amazing how much that actually changes, and it's a really good way of, as I say, helping to assess what's going on. So just before I run on to some artificial insemination stuff, just in conclusion, I suppose, when we're timing when it's best to breed a bitch, it's a combination of all these techniques together. We're not looking for just one test to be able to pick what's going on. So it's all three of those techniques helping to stage the ideal time to actually be breeding our bitch. It's important too, obviously, from those progesterones, you know, if we're getting post-ovulation progesterone, we're still not able to get a mating, then we know that when we need to do our artificial inseminations, if we're worried we're going to do our artificial inseminations too late, we can do our vaginal smears to make sure we're not actually going to cause more harm than good. So all these things sort of move together to get that to work properly. And then sometimes it all just happens when you don't do anything anyway. But then you get... What happens when you can't get a mating? I'm sure that's some sort of cross people are doing nowadays. So what do we do? So I'm just going to talk about what I do for artificial inseminations for the last part of the talk. We do all of our inseminations by transcervical insemination now. There's good publications and data showing that we'll get a better pregnancy rate. I'm not comparing this to natural mating. I still think natural mating is the best if you're using fresh sperm and the dog's got good fertility. But when we compare it to vaginal insemination, there's between a 15 and 40% better success rate published with transcervical insemination than vaginal insemination. Lots of factors that come into this. I do think vaginal AIs will work better in small breeds of dogs. You get big breeds of dogs like some of the Mastiffs and St. Bernards, and they're very hit and miss when we used to just do vaginal inseminations. We've published and shown that we can get a better pregnancy rate with frozen semen if we do it by transcervical insemination rather than with surgery. So that was about 5 years ago we published our results there. And when we look at it, most of the published data about artificial insemination with fresh chilled and frozen semen in dogs is actually by a transcervical technique. So in Scandinavia, they use what's called a Norwegian catheter, and they have done since, I think, 1973. And it's a blind technique where they palpate the cervix through the bitch's abdomen. They have a catheter that's within a stylet that's within a catheter that they pass into the level of the cervix, pass the stylet through the cervix and inseminate the semen. I met a guy in Norway who's done this, Ragnar Thomason, since like the early 80s, and I once said to him, how do you do this in these big mastiff bitches? Because in these countries, surgical insemination is actually illegal. And he said, we just don't feed them for 3 days and then we can feel what's going on. But I still don't know how, but the guy's got a massive left hand from just all this palpation all the time. But all the published stuff is based on this technique, which a lot of people aren't aware of. We've now obviously moved away from that technique because it's a lot harder to learn now that we can use endoscopy, and so what you'd classically know as a TCI or transcervical insemination is all endoscope based. And so there's more and more publications here that are all based on the endoscope based method as the older guys are sort of retiring out of the system. And then we look at surgical AI, which people say is the gold standard, and there is one publication on the success rate of frozen semen by surgical insemination. All the other papers that have ever been published are descriptive, and they just describe how to do the procedure, which is a glorified dog spay. So it's important just to remember that, like I say, there's very little data to actually support. I'm not saying the method doesn't work, but there's very little data to actually support it, even though everyone says it's the best. So some misconceptions of transcervical insemination. You're better off to do 2 inseminations than 1. There's actually nothing in the publications showing this, other than if the timing of poor, the timing is poor, I should say, the timing of insemination is poor, then a second insemination is worthwhile. And when they say it's poor, it's basically if you rang me up this morning and said, Stuart, I want you to do an AI on my bitch today. We've done no timing whatsoever. Obviously, if we do another one, what day is it, Monday? On Wednesday, we're going to have a better chance of pregnancy than if we just did that one off. But most of us would only do these procedures if we're timing the bitches correctly, so there's no benefit to a second insemination. Aside from one person's published that you can by average, increase the litter size by 1 puppy. There's also publications showing that even from a natural mating, that's what I was saying earlier, that one good timed natural mating is enough. Gary England from England has published a few papers showing that bitches will get, like other species, what's called a post-mating endometritis. So even from a natural mating, that sperm and the prostate fluid that goes into the uterus is actually irritant, and that has to be cleaned out. So the sperm starts to separate from the fluid within a couple of minutes of going into the uterus. The uterus somehow separates it out, spits the fluid out, and the sperm goes up to the oviducts where the eggs are sitting. And so you get a really inflammatory process occurring there. So he actually suggests that a second breeding or a second insemination is actually detrimental to your pregnancy rate, because it's a bit like, you cut yourself today or you bite through your lip today and you bite it through that same spot again tomorrow. That's going to take a hell of a lot longer to heal than that if you had just done it that one time. So it's hard. A lot of this is theories, I suppose, and so that's part of the reason why I tend to do just one insemination as well, because to me it's sort of stirring that inflammatory pot and potentially making things a bit worse, which I'd expect would affect pregnancy. Some people say it causes pyometra, CH, which is the precursor to pyometra, cystic endometrial hyperplasia, inflammation of the cervix. But if you're doing it atraumatically, which is what it should be, things should just slide through, then none of that's a risk. If you did a surgical insemination of a bitch that was in the diestrous pregnancy phase, you'll still cause a pyometra. So a guy in Japan, Nomura, showed a number of years ago that even if you put inert materials like silk into the uterus in the pregnancy phase, you'll cause an inflammatory reaction and cause a pyometra. So it's no different. Some people think it's painful. The bitches just stand there, they're ready to be bred while we're doing it. So how do we do it? I always feel like it's I put that in there because I always feel like it's a Saturday or a Sunday. They all seem to be having to be bred. So that's why in my casual clothes there it was a Saturday morning we did that one. So it's important. We obviously do good timing of insemination is important when we're doing it by the techniques we described earlier. Handling the semen carefully, using the appropriate quality of semen. So it's also important when we're doing inseminations, and this is a whole nother lecture I'm not going to go through, but it's important to do a good semen assessment and actually assess that the sperm's good enough to get a pregnancy. And that's not looking at one drop under the microscope and going, wow, there's swimming sperm there. Are they good swimming sperm that are there that's got a good chance of pregnancy? And we just need to be, I suppose, diligent with the technique while we're doing it. So we don't try and centrifuge the semen samples after we've collected them, unless for some reason we had a very large volume. But when we collect the semen, we separate the 3 fractions. Dogs ejaculate in 3 fractions, so prostate fluid, sperm-rich fraction, prostate fluid, which is when they would normally tie. We separate them and often get that, the sperm-rich fraction is only 1 mil to 1.5 mil, and often get people almost disappointed. They're like, oh, last time he was collected, he gave 15 mils. Well, that's because it's all mixed in with the prostate fluid. But when we look at how the dog ejaculates, the sperm comes out first and then you get prostate fluid coming afterwards. So, and they're different pHs, they're different viscosity of fluid, and so we believe that prostate fluid is helping to push that sperm up into the oviduct where the eggs are sitting. So that's why we do it separately. And when we inseminate, we do the opposite. You know, even if we were doing vaginal inseminations, you'd always put the sperm in first and then follow it with prostate fluid or artificial extender if the prostate fluid is not good enough. So we continue to inseminate until what we feel is, excuse me, the uterus is full, and we put in much larger volumes than what would happen in a surgical insemination. Interestingly, I think because the bitch is awake during the procedure, the uterus sort of allows to take up a larger volume of fluid, whereas when they're asleep, I've tried before, when we used to do surgical AIs, and it's really hard to get large volumes in there. So some of these, especially frozen semen, some of the types of semen we actually get large volumes once you extend out the sample adequately. And if you need to reduce the... I can't see that if I stand over here. So we need to... if you had too large a volume to do a surgical insemination, you've got to centrifuge your sample down. I always sort of imagine when you're spinning this sample, the sperm stuck to the outside of the tube, and I just figure the more we process it, the less viable it's got to be when we want it to go into that bitch and actually work. So as I said, Bruce Iltz in America published and presented at a conference in Australia back in 2013. His results from, it's quite a good study, there's I think 500 bitches in this study comparing fresh semen insemination versus a vaginal insemination. He got a 40% difference in pregnancy rate. There's a Turkish group that got I think a 15 or 20% difference in pregnancy rate. Nicole and I at our clinic have published our results and showed that we got a 20% better success rate compared to our surgical insemination. I think in general it's easier for you guys that you have one vet visit rather than 2. The stud dog only has to come in the once. It's easier for me trying to find appointment times as well. And also because we're putting it in the uterus, we get a better pregnancy rate. You know, no anaesthesia. Every now and then we need to sedate a bitch that might be a bit fidgety, and we use very low doses, just enough to take the edge off them a little bit, so they'll stand still on the table for us. But I probably sedate 1 a year if I'm lucky nowadays. And as long as you're careful, there's minimal to no risk with the surgery. Whereas obviously, when you're doing a surgical insemination, there's a risk of death under an anaesthetic. So it's a fairly large risk. So it's got a steep learning curve, as I said, but it is easier because we can actually see on the TV screen what's going on compared to the method where you're trying to palpate and do this thing blindly, and then you've got to be pretty confident you've actually put your stylet in the correct place. The cost of the equipment's come down dramatically, which was always a inhibitory thing years and years ago. But yeah, nowhere near what it was. We need fairly good hand-eye coordination. People often say to me, you must have been good at computer games, but I was never actually allowed to have computer games when I was a kid. So everyone else got a motorbike and I got a horse. So the only boy at Pony Club, which is not good when you're a 10-year-old. So obviously there are some bitches that this is very difficult, and even I get the odd one nowadays that I just physically can't get the catheter in, and the only alternative at that point is a surgical insemination for an intrauterine insemination. So just got quickly, so this stuff's not in your notes, because because I've published it and it's part of the conference proceedings, so I'm not allowed to. I can present it here, but I'm not allowed to give you a paper copy of it. So these are just our results with our TCIs. And it's interesting, everyone sort of quotes how good their pregnancy rates are, and I must say I used to probably be the same. You don't know what your results are until you actually go back to the data and actually look at it, and it's never as good as what you think it is. Because we often get asked what our pregnancy rates, I'll go through it in a sec, what our pregnancy rates are with fresh, chilled and frozen. I knew my frozen ones really well, but until I went through this I didn't really know our fresh ones. So we've got to remember, we look at sperm numbers is basically what we look at when we're inseminating, and chances of pregnancy, but there's a hell of a lot of bitch factors that come into this that everyone forgets about. You know, there's breed makes a difference. Some breeds are a lot less fertile than other breeds. You know, there's some breeds, I think you could just about get them to sit on some sperm on the ground and they would get pregnant. Other breeds are just very, very difficult. You know, you get lines of animals that are got poor fertility. Histories of uterine diseases, often you don't know about different health issues. Genetic history is often unknown. But there's all this stuff that we need to take into consideration. Even the frozen semen, when we look at it, you know, I didn't collect all the semen that I use. You know, some of it's come from overseas somewhere, someone else has frozen it. I don't know the health status of that dog. So there's lots of things that come into this. When it was frozen, who transported it, how was it handled. I presented some other stuff at the conference last month, just showing how a small change. So I had an issue with some semen straws that came to me that had been relabelled. So they came from overseas, and when they were initially frozen, no one wrote a microchip number on the straw. And you can't bring in semen into Australia without a microchip number on the straw. So someone said to someone else, oh yeah, you just put a new label on it, it'll be fine. So they put new labels on it, and the semen we got was absolutely rubbish. I think the motility was about 10 or 15%. And so I did a little experiment because they were telling me overseas that it doesn't affect the quality of the semen. They've done it so much. So I got the special labels that are supposed to stick to frozen material. You still had to pull these straws out of the liquid nitrogen to put the labels on. And I reckon it took me 10 seconds of pulling it out, wrapping this label on and throwing it back in. And if you looked at the sample grossly, it was still completely frozen. And I'd originally cut each straw in half, so I had half a straw I relabelled, half a straw I didn't, and I compared the post-thaw motility of each half of the straw, and we got a 40% difference on, I think it was, on average, difference in motility rate, which is going to be correlated to fertility rate as well. But if you looked at these straws, they just looked normally frozen. Because you've got to remember, frozen semen stored at minus 196 degrees. All you've got to do is hold it out for 15 seconds and it might get to minus 100 degrees. And those sperm are actually starting to wake up, and then you go and plunge them back into liquid nitrogen and you're refreezing them. So you're going to cause a lot of damage to them. So, like I say, I can't emphasise that enough, like getting someone experienced to be handling these samples. Especially dog sperm, I think it's a lot less, what do you call it? Yeah, I think cows, horses is not very good. Horses die because the wind changes direction. I think their sperm's the same. So cow stuff's pretty tough. And so it's all these things that we can't control. So in 15 years of doing this procedure with fresh and chilled semen, where is it? So fresh semen, we've got an average pregnancy rate of 86%. Which is interestingly only 10% or 8% above what I get for frozen semen, whereas I would have said, before I actually looked at my data, I would have said, oh, we get 95% pregnant without a problem. Our chilled results probably would be higher than this now. I tend to use chilled semen differently, how we did a number of years ago. Chilled semen, for those of you who don't know, is when you collect sperm in Perth this morning, it gets put in with a media at 4 degrees, shipped overnight, and we put in the bitch tomorrow. The people that make these extenders tout that they've done all this research that they're 5-day extenders and they're 10-day extenders. But it's also since been now shown that once the sperm has been chilled for more than 24 hours, you get marked DNA damage to the sperm. So the motility of it might look good, but the DNA quality in the head of the sperm is not very good. So I used to have too much faith in the manufacturers, so we'd often be inseminating 2 to 3 days after the semen was collected, whereas now I'll always have the sperm collected the day before I want to inseminate, which improves our pregnancy rate quite a lot from that. Average numbers of pups with fresh semen is 5.5, ranging obviously from 1 through to 19 is our biggest litter. I wouldn't wish that on anyone. Especially the vet doing the caesarean, which was me. So the minimum recommended number of sperm to inseminate is 150 million motile sperm. In our results, I couldn't find a statistical significance with fresh sperm and chilled between over and under 150 million. But with under 150 million, we have very few samples. So they tend to be toy breeds of dogs, which, get pregnant with 20 million sperm anyway, because that's all they ever ejaculate when you've got testicles that are 5 mils in diameter. But an important thing is the progressive motility. So the progressive motility is a progressively motile sperm is a sperm that can move at least its body length in a second straight. So when you have less than 70% progressive motility, you have a markedly reduced chance of pregnancy compared to when you have a greater than 70% progressive motility. So we look at frozen insemination, so we've got nearly 1,000 samples in there. Our overall pregnancy rate is 69%, where is it? When we're using over 150 million, we're getting 80% pregnant. Under 150 million, it's 70 something. 70%, and then we've got under 100 million, we've only got sort of a 60. So there's roughly a 20% difference between over and under 150 million motile sperm. So a couple of people have published that you need to put in over 200 million sperm to get maximal pregnancy rates. I actually got a lower result when I used higher numbers of sperm, but I think for us it's probably a low number of samples that are actually in that bracket. It's pretty rare that you'll get a frozen semen sample that we've got over 200 million motile sperm in it. But again, the progressive motility makes a huge difference for the pregnancy rate. We want a minimum with frozen semen of 40% progressively motile sperm. Again, average number of pups is about 5, so I think they're basically all about the same in average. And we've had 1 through to 16 in terms of size. So basically, we know that the more sperm we put in, the better our chances of pregnancy, but I do think there's a ceiling effect of it, and if you graph it out, you get what's called an inverse exponential graph, and it gets to a point that doubling your number of sperm is not going to significantly increase your chances of pregnancy. And this is the whole thing with this, it's still statistics, so it's a gamble, because for you individually, your bitch is either pregnant or not. We're looking at what happens on average. There's an element of luck if everything's correct and right, whether you end up in the 20% that doesn't work or you end up in the 80% that does work. Obviously too, there's a trend for a higher pregnancy rate with higher post-thaw motility. So just in conclusion, so with this technique we can get greater pregnancy rates compared to a vaginal insemination or a surgical insemination. It allows us to use less processing of the sperm, which I think is important. And the timing and that breeding management I was talking about earlier is imperative to make sure we're putting it in at the correct times. And I'll say, your results are never quite as good as you think they are until you actually plot it out. So, any questions? This is my dog that everyone in the clinic is scared witless of. He's a little lamb, but he only likes about 5 people. And he's fluffy, so everyone wants to cuddle him, but he doesn't quite like that. So I think he's scarier than a Rottweiler. So any questions?
Stuart, yes, could I ask you about the drug, I think it's cabergoline? Mm-hmm. Can you tell me what it's used for and do you recommend it?
So cabergoline is a prolactin antagonist, a serotonin dopamine agonist, sorry. Cabergoline is a drug, has different effects on the cycle of the bitch at different stages. So basically cabergoline lowers prolactin levels. So we can use it to bring bitches into season that have had a prolonged period between cycles. We also use it to dry up milk in bitches that have mastitis, say, or their puppies are dead and we need to dry their milk up. So it depends on the stage of the cycle what effect it's having. So it actually gets rid of, as well, during the pregnancy phase, it can cause abortion. And so it will get rid of the corpus luteum and drop their progesterone level. Is that what you want to know?
Well, I think so, yes.
Yeah.
My bitch has been put on this drug because she didn't conceive last cycle, and I'm just confused whether I should keep her on it, or would you recommend it or not?
Yeah, look, there's some theories that cabergoline also stimulates LH and FSH and may increase the fertility of the bitch, but there's nothing good that's proven that. So I personally only use it for drying milk up, bringing bitches into season. Bitches with uterine issues, I want to short cycle them. Is my only use. Yeah.
Thank you.
That's all right.
Hi, Stuart. I'd like to know what the main reasons would be for a breeder to want to adopt this kind of artificial insemination rather than going with a real dog. Like, why would I want to have my dog artificially inseminated rather than go to a sire somewhere? Or,
As I said earlier, I think a natural mating is the best if you're using fresh sperm. The benefit of all these techniques is that you're going to analyse the dog's sperm at the same time. So you could get a dog's semen assessed 2 months before you want to breed him, but that doesn't mean at the time you breed him his sperm is still good. Right, so sperm changes a lot.
With a real live mating?
Yes.
Yeah. Okay.
But the mainstay of why we're doing these procedures is frozen semen, chilled semen, and also you just can't get that mating when you're supposed to. So you've timed the bitch and you know you need to be breeding her over the next couple of days and you just can't get a pregnancy. So what do? The UK, it's illegal. So I don't know what they do, it's just bad luck. So, you know, you've got this whole issue of these bitches only cycling every 6 months. So do you just forget about this cycle and don't breed her, or do you do an artificial insemination?
Okay, yeah. Thank you.
That's all right.
Hi, Stuart. Good to see you again.
Thanks, Shireen.
I've just got a question regarding, I've had a bitch who was 2 months late to come into season, and when I took her in for a swab, Nicole did it, and she said she should be in soon, in, say, the next month. What is she looking at?
So you get changes in the cells. So as I was showing you earlier, the dogs that are in anestrus, the inactive aspect, you've got round cells that look like fried eggs. When a bitch is about to come in season, you're getting some rises in estrogen fluctuation occurring as the follicles start to develop. So you get a mixture of these round cells, and then some of them have some angulation to them or estrogen effect. Yeah.
Stuart, I'm just wondering, when you say that with the canine bitches, because they don't shed their lining of their uterus like over years, so do any of the cells absorb, or do they just keep building up? Because in a human female, we know they shed the lining. So what happens? Do they just keep accumulating, or do some of them get absorbed? Or
they do accumulate to a degree, so they sort of do both. So they'll increase, so the glands, so there's glands in the uterus that produce the milk that nourishes the early embryo, they continue to enlarge, but at the end of the hormone responsive time, they actually shrivel down, but they never go back to the same size as they were to start with. They do, I shouldn't say they never slough the lining of their uterus, they do to a degree slough the lining of their uterus when they have a litter. And so that's why pyometra is much more common in bitches that 6+ years old that have never been bred before. We do see it in younger dogs, but it tends to be in older dogs. And so that's why, from a fertility aspect, we'd normally recommend to breed the bitch young. Even if you don't breed for another 2 or 3 years after that, it's going to be a healthier uterus at 5 or 6 than if you just left her till 5 or 6. Yeah.
Yeah, just wondering if you prove a bitch and then you decide you want to use frozen semen, back-to-back litters, or do you give it a seasoned rest before you...
I actually like using frozen semen on maiden bitches more than proven bitches. We have a slightly higher success rate in maiden bitches, but if in that case I would do it back-to-back myself, because I would believe that the uterus is going to be healthier after that litter than if you skip a season. Yep.
Stuart, a question about reading the grading the number of sperm in the test results in terms of motility. Is there a lot of variety in the apparatus that actually gives you a figure for the number of sperm?
Is in the number of sperm or the number of motile sperm?
So the number.
So because there's lots of different devices around. So some devices just purely tell you how many sperm are in the sample. There's lots of issues with different ones of these two because they all work by light through a density gradient essentially to tell you how many sperm. So a lot of them you actually need to have it diluted to a level that's going to be accurately measured. There's not that many machines. There's a CASA machine or computer-assisted semen analysis that we use that will count your moving and non-moving sperm fairly accurately. There's another machine called a nuclear counter which does exactly the same as well. They all work by similar methods. Most people, when they're looking at semen samples, though, are just purely looking down the microscope and going, oh, yeah, it's about 70% moving.
Yes.
And that's a really hard... It's interesting, before we got our computer-assisted analysis years ago, I did a course in Sydney and this guy had done his PhD work. And it was all by VHS video as well. And he'd gone through frame by frame of these sperm videos to trace the sperm to actually work out exactly... This is all for teaching bull guys, essentially. How many sperm are actually motile and how many are immotile. And so he had all these videos that he knew that's 60%, that's 35%, that's 25%. And he used to run these courses to teach people how to get their eye in. It's interesting because you go in there going, wow, that's 80% motile, but it's really 40. Because what happens is when you've got a moving sperm sample, your eyes are distracted by the movement and you tend to look at all the moving ones, whereas when I'm teaching people to look at it grossly to work it out, you've got to look at the ones first that aren't moving and realise how many of them there are, and then sort of focus your eyes back to actually work out how many in comparison are actually moving around, if that makes sense. But yeah, most people don't have that machinery. Yeah.
From one of our live streamers, they're saying, what contributes to absorption of fetuses?
There's another lecture. Lots of things. The most common cause, so absorption, I'm sure you've probably all heard about it, is essentially a pregnancy that develops, the fetus gets to a certain size and then it dies off and disappears. So it's a bit like women miscarrying babies. The most common cause is some genetic abnormality with the fetuses. So, you know, either genetic incompatibility between the male and the female, or issues with the dog's sperm, issues with the female's eggs, infection at the same time, viruses, there's diseases, there's lots and lots of things. Probably aside from genetic issues, the next most common issue I would see as a problem would be diet. All the grain-free diets that are on the market now, which are very trendy, have high phytoestrogen levels, which react like estrogen. They cause thickening to the lining of the uterus, reduce blood flow to the fetuses, and increase your chances of problems. It's a very short 1 hour lecture. Yeah.
Is there any evidence, Stuart, that variations in temperatures, daily or seasonal temperatures, have an effect on the fertility or the number of pregnancies over a period of, say, a very hot period of weather?
Certainly with sperm quality, we will see changes with the weather, and I think especially in Australia because we get such extreme changes in weather. It's interesting, when you get the first change in the weather, so you get to sort of November, December, when you start getting some really hot days coming through, the sperm quality in dogs will drop dramatically because of that increased temperature. Obviously the testicles are outside the body, they should be at a lower body temperature for ideal sperm development. But if you have consistently hot weather, it's almost like the body adjusts for it and it learns to cope with it. So, but in terms of best semen samples, I do think you get them in the cooler months of the year. Yeah.
This is a really silly question.
No such thing.
So if you have like free access to a dog, you only use that dog once or twice, or can you just let them have a honeymoon for as many days as they want?
Look, you can let them mate as much as you want. One of the problems is, though, I do think if you start too early with the breeding, depending on the stud dog, like a good stud dog will mate a bitch no matter what. Like I spoke about bitches with anal gland infections and all sorts of stuff. But there's a lot of stud dogs around that are not strong, good stud dogs that would do that. And so if you start mating your bitch too early to try and do that, a lot of these dogs will get desensitised, and then you end up at us trying to do an artificial insemination, and then I'm getting tennis elbow trying to get sperm out of the dog because he couldn't care less about the bitch. So yes, a good stud dog, yeah, that would be fine. And getting the bitch pregnant overall is not difficult. If you mated a bitch every second day for 10 days, she would get pregnant. But it comes down to how good that bitch is to stand for the mating, how good that male dog is to breed her as well, that I think is what changes things, and you can't predict often where the timing comes into it to do it at the correct time.
You were talking about infection with too much breeding. That's sort of what I was thinking.
Oh, with the inflammation?
Yep.
Yeah, look, a natural mating I wouldn't be as worried about when you're doing artificial inseminations, that you're scraping things along the lining. Yeah.
If the Department of Animal Welfare asked you to write regulations that had the welfare of the bitches uppermost, what would it say about breeding ages, and what would it say about when you breed them?
That's a loaded question. Thanks, Sylvia. Not the ages that you guys have come up with, I must say. Like, we're always taught third season or 18 months, you know. There's a lot of large breeds that we deal with that have poor fertility, that cannot be bred until they're 2, which I think is myself crazy. And I don't think, it certainly breed differences, but the younger the bitch is bred, I think the better myself. Like, I would want her mature, so I'd want her at least over 12 months of age. But I think you're better off to have a litter in an 18-month-old bitch than trying in a 3-year-old maiden bitch, which is often what happens. The 2-year-old ones, especially in these large breed dogs, are almost a bit too late when you're starting, and they've often only fertile to their 5. It really limits what you can do. But then you get your little breeds like Jack Russells that can breed till they're 10 without a problem. So sometimes. But yeah, so I do think there should be some sort of minimum ages. Certainly I wouldn't want something under 12 months of age, because you can't do most of your health testing under 12 months. Even in a male dog, I don't think you really should be using a male dog under 12 months. For that reason, yeah.
Before you alluded to the timing in between matings, that you would go from one season to the next, whereas I think that's not actually supposed to be within the rules.
As in back-to-back?
But yeah.
So you're allowed to have... So the Victorian legislation is the same as the Dogs Victoria stuff, that you can have no more than 2 litters within an 18-month period. So you can do a back-to-back breeding.
What if they have 6 months apart?
That's fine, as long as you then skip the next one, so you don't have 3 within an 18-month period.
Okay.
Yeah, without a veterinary certificate.
Hello, Stuart. I was just wondering, when we end up with caesareans for various reasons, what's the recommended timing for the next mating from the uterus's point of view? Just assuming it's a standard caesarean, nothing dramatic happens other than just getting the puppies out.
Yeah, if everything's healthy and the bitch recovers, I don't have a problem with you breeding on the next cycle. And then it comes down to, why did they have the caesarean in the first place? If you've got some sort of uterine disease problem, which is why she's had a caesarean, then I'd be more likely to want to breed with her on her next season rather than skip one and increase the risk of getting major problems coming through. But as long as the bitch recovers and is
It's
healthy.
all right. So, like when two come down together, or just it's an accident, or someone gets stuck.
But if it's just a normal healthy
Yeah,
bitch, we'd probably more skip a season and breed on the next one. Like, there's a lot of variabilities that comes into when you do it.
Yeah.
Yeah.
Thank you.
Stuart, is there any truth in the theory that if you've got a dog that's not used very much, that to actually collect him and throw the sperm away and then use him on a second time?
Yeah, it's a common question I get asked with that, to have the clean out.
Yeah.
Personally, I don't think it's necessary in most cases in dogs.
No.
I've seen many a sample that people want to come in and they want to do a semen freeze. So they come in this week to get the dog cleaned out. So that next week we've got a better sample. And I've been caught so many times that the clean out one was fantastic and the one next week is rubbish. So,
there's
I
no
don't think
truth
it's
in
necessary.
it.
But you can also over-collect a dog as well. So
Yeah.
I've come across a number of people that collect their own dogs on a regular basis. And so if you collect your dogs too regularly, you'll actually reduce their sperm output.
Right. Yeah. It's just a dog that's not used very much.
But the sperm, if the testicles and the epididymis is functioning correctly, the old sperm is constantly getting thrown through. So the only time that actually does make a difference is a specific defect in the sperm called a detached head. But they're dogs that have an epididymal dysfunction, which is where the sperm's stored, and it's not flowing the sperm through all the time. So the sperms sit there stagnant and the heads fall off the tails.
All right.
Those dogs, if you collect them regularly, you'll actually get rid of that problem because you're forcing the sperm through. But as a general rule, I wouldn't be bothered. No.
Okay, thank you.
I've been a breeder for 40 years, and this year I've seen something I've never seen before. Two of my bitches, one was just turning 2 and we were going to mate her for the first time, and she came into season and she had no bleeding at all. At about the right time, the vulva was swollen, the dog was interested, but just no bleeding, full stop. So she seemed to have a normal season with no bleeding. Is that common or just very unusual?
I think it's common, but I think it's all the weird ones. So it's what's called a silent season. It's not uncommon, and those bitches are just as fertile on that cycle. And so that's where your bloods and your vaginal cytology comes into staging it. It's really just an underreaction to the oestrogen to a degree. And you can get the opposite, an overreaction to oestrogen, where they get a vaginal hyperplasia with a big lump that hangs out the back of the vulva.
So there's a reasonable chance that she would perhaps do it normally next time?
I usually find bitches that have silent seasons tend to do it every time.
Do it every time, okay.
Yeah.
Interesting, thank you.
Hi, Stuart. Just relating to the other question about cleaning the dog out, I was wondering what would be the shortest duration that a male dog can serve females consecutively? How long do they need for recoveries between services?
So the guy, Gary England, I spoke about earlier, he published a study showing that a dog can be collected the same day as long as there's at least 2 hours between collections and ejaculate up to 75% of the original amount. But as a general rule, we'd leave it at a day. They're not rabbits that can do it 18 times an hour. Rams that'll cover 50 ewes in a night, Dogs aren't quite as good.
Has there been any studies done on dogs that are used often at stud compared with dogs that are used infrequently? So one every, twice a year compared with one that's being used every month or 2 months. Because I understand in humans there seems to be a higher fertility in males that have more regular intercourse. Yeah.
Human fertility is terrible.
I did read it, and it seemed to make sense to me.
What I would call a bad semen sample in humans, they'd say is fantastic. So, not to my knowledge in dogs, there's no studies like that, no.
Any more questions? Sorry to be a dubious question. Anyway, thank you very much, Stuart, for coming along and giving your third lecture. I hope we'll give you a rest for a few months. But I'm sure everybody's found it really interesting, and it's great when you're actually here in person because it has much better impact, and you can recall what was what was said, and then you can read the notes. So thank you very much indeed for coming along again.
No worries. Thanks, Wendy. Thank you.